This program provides you with a detailed guide to the required steps for the preparation and intramuscular administration of the Sandostatin LAR depot injection for your patients. Sandostatin LAR, octreotide azacetate for injectable suspension, is indicated for acromegalic patients who are adequately controlled with Sandostatin administered subcutaneously, including those in whom surgery, radiotherapy, or dopamine agonist treatment is inappropriate or ineffective, or in the interim period until radiotherapy becomes fully effective. Sandostatin LAR is also indicated for the treatment of the severe diarrhea and flushing episodes associated with carcinoid tumors in patients in whom symptoms are adequately controlled on subcutaneous treatment with Sandostatin. Sandostatin LAR is also indicated for the treatment of the profuse watery diarrhea associated with vasoactive intestinal peptide-secreting tumors in patients in whom symptoms are adequately controlled on subcutaneous treatment with Sandostatin. In patients with carcinoid syndrome and vasoactive intestinal peptide-secreting tumors, the effect of Sandostatin LAR on tumor size, rate of growth, and on the development of metastases has not been determined. Please consult the Sandostatin LAR prescribing information for important contraindications, warnings and precautions, adverse events, and patient selection criteria. Sandostatin LAR must be given only by deep intragluteal injection, never intravenously. The site of repeat intragluteal injection should be alternated between the left and right gluteal muscles. Each Sandostatin LAR kit includes everything you will need to prepare the suspension and administer the injection to your patient except for alcohol swabs. Each kit contains 1 vial of Sandostatin LAR 10 mg, 20 mg, or 30 mg octreotide azacetate for injectable suspension, microspheres for depot suspension, 1 pre-filled syringe containing the diluent, 1 19-gauge 1.5-inch 40 mm standard needle for transfer and drug product reconstitution, 1 19-gauge 1.5-inch 38.1 mm safety injection needle, 1 instruction booklet, and 1 leaflet. The kits should be stored in a refrigerator when not in use. Keep vial in the outer carton in order to protect it from light. Before we get started, there are 3 key points to remember about Sandostatin LAR. Firstly, it must only be prepared immediately before administration. Secondly, it must be administered at room temperature. And thirdly, it should only be administered by a trained healthcare professional. It is important to follow the next instructions carefully to ensure complete saturation of the powder and its uniform suspension before intramuscular injection. Let's move on to look at the process in detail. Before handling the component, allow the Sandostatin LAR vial and pre-filled syringe with diluent to reach room temperature. This will take approximately 30 to 60 minutes. Wash your hands with soap and hot water, then place the package on a clean and flat surface. Remove the flip-off cap from the vial containing the Sandostatin LAR. Assure that the powder is settled at the bottom of the vial by lightly tapping the vial on a hard surface. Remove the cap from the pre-filled syringe with diluent and attach the standard needle supplied for reconstitution to the pre-filled syringe with diluent. It is very important to make sure not to use the safety injection needle at this stage. Clean the rubber stopper of the vial with an alcohol swab and insert the needle through the center of the rubber stopper of the Sandostatin LAR vial. Without disturbing the Sandostatin LAR powder, gently inject the diluent into the vial by running the diluent down the inside wall of the vial. Do not inject the diluent directly into the powder. Withdraw the needle from the vial. To avoid contamination, please make sure not to expose the needle to surfaces. Do not disturb the vial until the diluent has totally wetted the Sandostatin LAR powder. This will take approximately 2 to 5 minutes. Without inverting the vial, gently check the powder on the walls and bottom of the vial. If dry spots exist, allow undisturbed wetting to continue. At this stage, prepare the patient for injection. Once complete wetting has occurred, the vial should be moderately swirled for a minimum of 30 seconds until a uniform milky suspension is achieved. Do not vigorously shake the vial, as this may cause the suspension to flocculate, making it unusable. Peel off outer label from the pre-filled syringe with diluent after product reconstitution. As with all parenteral admixtures, the constituted product should be examined for the presence of foreign particulate matter, agglomeration, or discoloration. Any defective units should be discarded. Immediately reinsert the needle through the rubber stopper, and then with the bevel down and the vial tipped at an approximately 45-degree angle, slowly draw the contents of the vial into the syringe. Do not invert the vial when filling the syringe, as this may affect the amount withdrawn. It is normal for a small amount of residual suspension to remain on the walls and bottom of the vial. This is a calculated overfill. Remove the needle for transfer from the syringe and immediately attach the safety injection needle to the syringe. Gently invert the syringe as needed to maintain a uniform suspension. The drug is now ready for administration. The administration must occur immediately after the suspension has been prepared. Clean the injection site with an alcohol swab. Remove the needle cover and expel any air from the syringe. Insert the needle into the right or left gluteus and draw back to ensure that no blood vessel has been penetrated. Inject slowly intramuscularly by deep intragluteal injection with steady pressure. Sandostatin LAR must be given only by deep intragluteal injection, never intravenously. Once the injection is complete, using a single-handed operation, activate the safety system of the needle, either with help of a rigid surface such as a table, or with a forefinger, making sure to always keep all fingers behind the needle tip. An audible click confirms the proper activation of the safety mechanism. Immediately properly dispose of all packaging and devices implemented for the preparation and administration of the drug product into an approved sharps container. Again, Sandostatin LAR must be given only by deep intragluteal injection, never intravenously. Sandostatin LAR is injected once every 4 weeks. The site of repeat intragluteal injection should be alternated between the left and right gluteal muscle every 4 weeks. Do not use the same gluteal region each time. If you have any questions about the preparation and/or administration of Sandostatin LAR, please contact the Novartis Medical Information Center at 1-800-363-8883.